When you look at in Kenya, when you come to Kenya, today we tested samples in the last 24 hours, about 1,434 samples. Out of those numbers, we have got 8 females and 7 male, and they range between 2 and 79 years of age. And since confirmation, you can see the numbers there, the 3,684 people. We have discharged 2,854, and we are monitoring at least 830 people. And those numbers will go up because we have increased our testing capacity. We have increased the what we call targeted mass testing. For instance, today we have got a big team in town that is going to go some of the areas I'm going to mention in a minute. Moving on, we have got next slide. Moving on, we have got the graph here illustrates, and this is an important graph. This illustrates the number of cases, as you can see, in comparison terms. When you compare what is going on here, you can see this line up here of over 200,000 cases. This is in Italy. You know, it's 203,000 cases. And when you come lower down, you can see Ghana at 1,671 cases. The Tanzanian figure, as at I think 3 days ago or 4 days ago, stood at about 480 cases. And here is Kenya. Kenya, that figure has also changed. It is not 396 since we did the graph. It is now at 411. 411. Kenya has 411 cases. Now, when you look at the analysis of our cases, where are these cases and where are they coming from, then you can see we have got 411 confirmed cases. We have got 150 people who have recovered. In other words, 36.5 of the people who have gotten the disease, just about over 1/3 of the people who have gotten the disease have recovered. And remember, the global fatality rate is 7%, and you can see ours is slightly lower at 5.1%. That's why we have isolated Mandela, just to save them from that. And we have isolated from the borders here, so that we can contain the situation in Mandera. You can see that Wajir is following now with 2, we hope that because of the closure of the border between Mandera and Wajir, we now need to close Wajir and Somalia, so that we don't spread the disease out there. And in Kenya, what you are seeing here is, if you look at the red represents figures of over 150. And those are essentially Nairobi, out here, and Mombasa. And when you look at the coastal region, you can see Kwale down here with 2, Kilifi with 8, and Mombasa at 124. So Mombasa, again, in today's figures, for example, today we had 15, and out of the 15 that we got today, 11 come from Mombasa. So Mombasa is beginning to be a worrying situation, and further measures, we have to take further measures to contain Mombasa. Now, again, this is just the trend of what has been happening in the country, and let me explain a little bit. 12th of March is when we recorded our cases, and then they started climbing up. As you can see up here, they started climbing up, and then that is when we started the mandatory quarantine at that date. So we went down a little bit on the testing. You remember we had issues of testing kits and so on and so forth. Then we declared the curfew here, and immediately after the curfew, you can see the figures begin to go down. But after that, then we started now testing the people in quarantine at that time. And you can see what happened when we started testing the people. Now, and that justifies the mandatory quarantining. Had we not quarantined when we did, these people you are seeing here, all these figures, would now have been in the streets. And we would be at a much, much higher figure. It is at this point that we are predicting, if we do not have the mandatory quarantine, then you can climb up the 10,000 figures. And you can see this. If this had continued going up, then you can see what the results would have been. And here you can see now, at this figure, we have got, is going up a little bit. We recorded 12, now we have gone up to 15. But the 15 is also justified by the higher number of testing of the samples that we took. Because if you remember, yesterday we had 777, and out of which 12, we had 12. Now we had 1,400, over 1,400, and we have 15. So you can see the increased testing producing those people. Now, let me just disabuse here some of the cases that have been, and this is why this is important. 0 to 4, people think that when you are young, you can't get the disease. But you can see that we have cases of 0 to 4, 0 to 14. In fact, we have cases as young as 2. You know, that's the case we have. When you look at the age groups, just in terms of the disease, you can see the 15 to 29s, and these are the young people. You can see that they have got, they are getting the disease. The 15 to 29 group, and it's very mobile. These are the people in nightclubs and so on and so forth, in pubs, in the evenings, and you can see now why curfew is an important part of the measures that we have taken. Again, a very active group between 30 and 59. Now, when you look at the gender, if you look at the gender distribution, you have got a 44%, or 181 of them being female, and the blue, which is the bigger group, 230 being male at about 56% of the cases. Now, this is a very important presentation as well, because this was the reverse. When we began these presentations, this was the reverse, that the local cases were much less than the imported cases. But as you can see, the imported cases now have, the local cases have overtaken the imported cases. Now, when we say that people should keep social distancing, and when we say that one person can transmit to very many people, this is the illustration that it has. This is a real case. What we are talking about here, what we have illustrated here, is a real case. And I've got two examples. One example is the first case in Kawangware. When the first case came into Kawangware, at this point, that was case number 189. From case number 189, immediate contacts, the immediate contacts that resulted from case number 189 is what we call case number 243, case number 244, and you can see these ones are together, which means they must have been somewhere together. They were collected together, and they were put in isolation, in quarantine together, and then tested. So you can see that 243, 244, 245. And then, at the same time, somebody took a bit longer, 258, 269, 270. All these cases are a direct transmission of case number 189. And I think this is a very important thing to see. When we talk about the fact that one individual is crucial and one person, now, and this is real. We are talking about real numbers. Now, then comes now the secondary cases. From case number 258, you can see what has happened. Case number 370, case number 371, because these ones came directly from here. Now, you might ask, why is it that case number 258 has got all these numbers and case number 243 does not have? It depends on how much activity this person had, at what time did we discover them, at what time did we isolate them, so that they do not go spreading it. But at the same time, there might be still ongoing ongoing people in quarantine who have not been tested on that case. And probably at some point, we will then have some other figures growing from that one. This is the case in Malindi. The famous case in Malindi, case number 14. All right? From case number 14, case number 15, case number 23. Now, this has gone on to case number 141, the contacts of the contacts, and now we have gone even further from the Malindi, from one Malindi case. And we have no idea what we are going to get now from all these other. This is just an illustration to show you the impact one individual can have in terms of the COVID-19 spread. And then the hotspots that have developed around the country and areas that we are currently working in. As we speak, there is a team, our team of health experts, and sampling is going on in Kawangware, where we now have 13 people. 13 people they have tested positive. Now, these 13 people are with us. It's important for us to say that these people are not in the streets. All these people you are seeing here are people who are in isolation centers. And there lies a very important exercise of contact tracing. Because unless we can contact trace these people, it means that these 13 people would now be spreading it throughout Kawangware. And it goes like fire. So the illustration here, again, in Kilimani, we have 6 cases in Kilimani, Keleleshwa, Halengam, in Kamukunji, 11 cases in Isli. You know how densely populated Isli is. So when you hear that there are 11 cases, we have now got a lot of those people also in quarantine because of those 11 cases who are now positive. So again, some other hotspots, South Sea. Then you can look at Kebra. Kebra, we have been very, very careful to isolate these people as quickly as possible. Because again, unless you contain them, and there's a team also that is also carrying out surveillance in Kebra, so that those figures don't keep on growing. Mombasa, you can see, Mvita is the main area. This is where we had an 87-year-old herbalist who died in that Mvita area, and in all these cases, actually can almost be tracked back to the same source. Again, Mombasa, KPA has been a big challenge. We believe that we have now kind of managed to collect and gather the people in KPA. We are watching it very carefully, but we have done quite a bit of testing within KPA and also isolated quite a number of people. But as you can see, the figures in Mvita are really growing. You know, and it is imperative that persons living in the Mvita area, what all these figures tell you is that they are a call for action. If you live in Kawangware, you know now that there is a center in Kawangware, and the disease is spreading in Kawangware. You know that if you live there. If you live in Mvita, you know that the next person you are talking to could very well be COVID-19 positive. Therefore, you need to take action. You need to keep your distances. You need to keep washing your hands if you come in contact with anybody. If you go to the market, you need to make sure that you are not touching stuff that has been touched by other people. And at least you keep on washing your hands. Anybody with a shop in Mvita, anybody who has got an Italy or whatever it is, you must follow the rules that we are making in order for us to keep Mvita safe. Again, on the issue of the people who have died, this is an interesting one, and the figures that we are finding point at females recovering a lot faster and in bigger numbers than the male population. See, 46% of the people who are positive are female. But when it comes to the death figures, only 19% of the people who have passed on, out of the 21, is it 21? Out of the 21 persons, because today we have We have 4. We have increased the death by 4 people. And out of those, 19% are female and 81% are male. It is, we believe that the reason why there is that disparity is because of preconditions that exist more in male than female, you know, high blood pressure, heart disease, etc., etc., etc. Again, we had established the disease. And this is why we are telling Nairobi people, stay in Nairobi. Please don't take this disease back to the older people up country. This is a perfect illustration of that circumstance and the reasoning behind. We have always told you that we are taking decisions based on empirical evidence and data. This illustrates that and explains it. When you go further down, you can see that between 30 and 59 and above 60 is the same figure. And if you break this down a little bit more, you'll probably find that this number of the 10 would lean more towards the above 50s than you would in the lower 30s. So that whole graph is to ask kindly and to urge people who are between 15 and 30 years old to note that you are carrying, you are passing it on and killing other people. Instead of contacting other people, distance yourself from them. At this moment in time, call your mother. If you're in Nairobi, don't go to see your mom, call your mom. Talk to her for the time being. A time will come when you can travel. Again, we have been talking about testing capacity, and this is a question that has been raised. These are the areas that have been carrying out the tests, and you can see as at now, we have had 21,702 samples. And within the 15 labs that we are continuing to expand testing capacity in other areas. I believe that as we expand, then even you can see here, for instance, where is Wajir? Wajir is, yeah, you can see, for example, we have opened out Wajir, you know, for testing. We are hoping that in the next couple of days, we are going also to open up Mandera for testing. So, and we will continue to expand our testing capacity. Our ongoing activities include expanded testing. For example, as you know, the presidents of both Uganda and Kenya have told us that drivers must be tested. So what the protocol we have established for truck drivers here is that we will test them in Mombasa. So before a truck driver leaves Mombasa, you must make sure that you have done your tests. You can do your test 48 hours before you leave. But what we are telling them now, we will not allow anybody, any truck driver, going to cross the border. Before you leave, before you get into a vehicle to depart, please make sure that you have been tested. Because what it means is that if you don't do that, then the Busia border, you know, there are so many people there at the moment. You are just going to increase the problem. And for that reason, therefore, our health officials are under instruction to ensure, and we are asking the enforcement agencies to ensure that drivers leaving their destination to go and cross the border have all been tested. It is also, as you know, to contain the disease because of the stopping of the areas that long distance drivers stop in so many places. So we will not hesitate. Let me just say this: we will not hesitate to close the restaurants that are not observing what we are saying, and it will be very expensive for them because you have already tested your people, you have already spent money, and then you get closed down. So please, as we move on, let's make sure that we keep that protocol. Again, we are continuing targeting the health workers. Any health worker is an ongoing process at all times that health workers must be tested so that, again, they do not affect people when they are being treated, when they are treating them. Additional, as I said earlier, additional testing capacity is going into Busia, Machakos, Kitale, and also Malindi. And as I mentioned earlier, an additional one there is Mandera. We are also scaling up the training of health workers against a continuous exercise. We have particularly targeted health workers who are going to be using ventilators, because there is specialized training for people with who are going to use ventilators. Continuing of mass productions of PPE, today we are here with Airtel, people from Airtel, who have come to make a presentation to us of some 6,600 locally made PPEs. So when we promised that we are going to increase the supply of PPEs, it is already happening. And within the next 2 weeks, we do not believe that there is going to be any county that is going to be saying that they do not have the PPEs. You must remember, however, that is a continuous exercise, because most PPEs are used only once and then left out and then thrown off or incinerated. Travel restrictions, as we have said, are still on. There is nothing that has stopped. All the measures that we have taken are there, and we still urge the public to be aware of the matter of distancing and all the other hygiene measures that we have taken.